Being a parent, sometimes we take things for granted, such as the hugs our children give us, the thousands of questions that we ask them to stop asking us, and the simple thing of them just calling us mom and dad. We forget that some parents don't get that right away. They don't get to experience that at all sometimes. At the end of my speech, I want you, my audience, to be more informed about autism. Autism is a developmental disorder. It causes problems with interaction and communication with others. Today I'm going to talk about what causes autism, the symptoms of autism, behavioral triggers of autism, the calming techniques, and therapy options for autism. People often ask, what causes autism? The causes of autism are unknown. Nobody knows what causes autism. According to www.autismsociety.org, it's abnormalities in the brain and the structure and the way the brain was put together. Researchers also believe that it could be a genetic problem, but there is no proven facts behind it. Even though the causes of autism are unknown, some symptoms to look for can range from mild to severe. Every person with autism is different. There is no two people that are alike with autism. You can have a long conversation with a person and not even know that person has autism. That would be the more mild side of autism. The severe side of autism would be nonverbal. That they just don't speak, they have no way to communicate with you. Symptoms can come from they can start from anywhere from 10 months to 12 months old to however old that you get. Some signs to look for are playing alone. Most children who have autism play alone. They don't like to play with others. They don't like to talk with others. Nothing. They reject interaction with others or eye contact with others. And they have kind of robotic speaking. They kind of talk like a robot. They also have repetitive behaviors like flapping their hands. They like to rock. They like to jump, bounce, and twirl. They often fixate on things or people also. Sometimes the fixation on things can cause behaviors because they want them or they need them and they're not getting them and they don't know a way to tell you that they need them. Some behaviors can be caused from sensory. It can be either too bright in the room or too dim. The food textures, it can be either too hot or too cold. The noises from your refrigerator, the lights, anything, little noises that we can't hear, they can hear. It can also be from pain, such as a toothache, a headache, a footache, and they have no way of telling you that. They could be about to have a seizure, and they can't say nothing, and so they have a behavior. Where that comes in communication, they're frustrated. They lash out. They either kick, hit, bite, slap, pull hair, or they even bite and self-injure themselves, hit themselves. All these are behaviors to look for somebody who has autism. And some calming techniques are change of scenery. Maybe move them to a different room. If you're inside, go outside. Try to get them out of the behavior that they're in if it's not a too severe behavior. Deep pressure, such as carrying weighted book bags, weighted blankets, or even just getting a massage. They like massage. You can offer them some sensory items too. Sensory items can be an item that they really like Play-Doh, putty, Legos. It can be anything such as candy, maybe 15 minutes with a video that they like. It's the first sensory. If someone is overstimulated, please try to avoid them. Talking and interaction with them can make things worse by a lot, so it's just best to leave them alone. There are many programs available to help people with autism. According to the CDC, there are many treatments available. Applied behavior analysis, also known as an ABA program. That's a program with the school districts, and they help people. Social skill training, occupational therapy, physical therapy, sensory therapy. They also have programs to help with communication and technology. You can have like an iPad, a phone to communicate. They can tell where they want to go or what they want to do, or even picture cards. We have covered what causes autism, symptoms to look for, behavior triggers, communication techniques, or calming techniques, and therapy options. These are all things that can help a person with autism. Even though autism is a developmental disorder, it doesn't mean that they cannot have a successful life. I know people with autism that have teaching careers. Even though that they break down and have frustration, this knowledge will help you think outside the box and help someone the best that you can.